2017 त्योभन्दा पहिला चाहिँ उहाँले चाहिँ सिरेक्युज युनिभर्सिटीको म्याक्सवेल स्कुलबाट पब्लिक एडमिनिस्ट्रेसनमा मास्टर्स डिग्री गर्नुभएको थियो र त्योभन्दा पनि पहिला चाहिँ इकोनोमिक्स र पब्लिक पोलिसीमा चाहिँ ब्याचलर डिग्री फ्रम स्वार्थबाट गर्नुभएको छ। बिचमा यो पढाइको क्रमको बिचमा चाहिँ 4 वर्ष काठमाडौँमा उहाँले एडिबीको लागि काम गर्ने र पढाउने काम पनि गर्नुभयो। सो युवराजी, इट्स योर टर्न।
Thank you. That was a very nice introduction. So I debated a little bit about whether to do it in Nepali or English. So it's going to be, I think it's going to be a mix of both. If I go too far towards Nepali, please do the translation to help our friend there. And so it's going to be a mix. English में गर्दाखेरि नबुझ्न कसैलाई गाह्रो छ? That's great. यो टपिक पनि त्यस्तै भएको हुनाले अलिकति हेल्थ इकोनोमिक्सको जार्गनहरु चाहिँ इङ्ग्लिशमा अलिकति हल्का सजिलो हुने भएको हुनाले I'll probably stick more to English than Nepali. The title of the presentation, as you can see here, is disability and a number of different outcomes. And I actually got into this research area a little bit by accident. So most of my research in Nepal and then parts of sub-Saharan Africa is focused on getting people to utilize healthcare services and addressing health disparities. So right now there's 2 RCTs happening as we speak on antibiotic dispensing practices by pharmacies and changing that behavior among people. There's one happening on getting people to go for breast cancer screening early on. This is in Ghana. And you know, as I was planning these studies, the pandemic hit and everything just stopped. And so I was looking for topics to work on. And in 2018, I had published a paper looking at between 1991 and 2001. And nobody had really looked at the long-term effects of that. And I was interested in seeing if vitamin D supplementation indeed reduced the chances of disability. And then that's how I first got started in disability. And I was interning at the World Bank back in 2005 as an undergraduate. And back then too, I was really surprised by how little work there had been on this topic. That still is the case. So if there are any students among you looking for research topics and you want to be influential, this is an area where there's been very little work. So the goal for today, with that little background, the goal for today is to share findings from these 2 papers that I recently published with a doctoral student who is now moved to LSE as a postdoc. One looks at the effect of disability on educational, labor market, and marital outcomes in Nepal. The other paper, also using data from Nepal, it looks at the effect of parental disability on children's outcomes. So if my parents had disability, how would my outcomes differ compared to somebody whose parents did not have disability? I want to start with the caveat that I don't have the necessary lived experience as far as disability goes, and so if you have any suggestions towards the end on areas where research would be useful from policy point of view, I'd be very keen to hear that. So throughout, I'll refer to the top study as the first study. This is the one looking at the effect of disability on your own outcomes. The second study as the second study, right? The parental disability and your outcomes of the second study. So here's the outline that I propose to follow. I'll just provide some little bit of background on disability in the global context, the research questions that I aim to answer with these 2 papers. And there's a little bit of preaching to the choir titled, Nepal's context part. I put it there for completeness, but I'm happy to skip, given that many of you may already be aware of this. I'll talk about the data, the empirical approach, and talk about the findings. And like I said before, towards the end, I hope we can discuss a little bit about what areas would be useful for research from a policy point of view. You may be surprised with some of these numbers. This is based on the World Bank's report in 2020. Roughly 15% of the world's population experienced some form of disability. This is not the extreme. And between 110 and 190 million people experience significant disabilities. These are likely undercounts because in many places those are either not reported, including places like Nepal, right? And then only severe forms of disability are reported in most cases. As far as countries like Nepal go, there's very little evidence on its effects. And that's an important omission because roughly 80% of people with significant disabilities live in places like Nepal and other LMNCs, where, as we know, social protection programs tend to be weaker or lacking altogether, and stigma against disability is pervasive. From a policy perspective, we look at the Sustainable Development Goals. 5 of them actually mention that the services that the governments provide should be disability inclusive. Nonetheless, there is this recognition that lack of data on disability and its effects is a limiting factor when it comes to devising policies to protect, to improve the well-being of individuals who have disabilities. I just put a quote there from a flagship UN report in 2018, basically saying that lack of data is a major problem when it comes to monitoring the situation of people with disabilities. So against that background, the 2 research questions that I wanted to answer in these 2 papers is, what is the effect of disability on education, labor market, and marital outcomes in Nepal? And I'll explain why we look at these outcomes, including some of the details of the specific indicators we look at. Do these effects differ by gender, given the pervasive gender discrimination in the country? And also, we wanted to see if the effects of disability sort of percolate across generations, so from parents to children and children to their offspring. What is the association between parental disability and children's outcomes? And then do these differ by gender? Do they differ by who among the parents has the disability? Right? There's some evidence in economics saying that investment decisions differ by gender of the parent, right? And we want to look at the same based on disability. The overall goal here is to respond to that call that I mentioned before from the UN saying we need more documentation. So the goal is to again document the effects of disability in a context like ours and generate some more evidence. Now here comes the preaching to the choir part. These are it's a little bit of context in Nepal. Disability prevalence vary widely, unfortunately, based on who you ask. Based on the 2011 census, which is what I use here in this analysis, it's 1.9%. Based on the 2021 census, which is not officially out yet, and this is based on a Twitter account of the Central Bureau of Statistics, so take it with a grain of salt for now. It's 2.2%. There's a slightly older numbers in 2011. They said that the number was 3.6%, but there's some really strange numbers using 2001 census, one report, and a fairly credible report. The World Report on Disability by the WHO and the World Bank. They said that as many as 21.7% people could have some form of disability in the country. It seems high, but then if you look at some other countries, numbers that we'll go with for now is roughly 2%. Again, based on the census, the 2011 census, among men, physical disability is the most common. 36% of those who have disability reported having physical disability, followed by vision and hearing-related disability. Among 33%, among women, it's sort of flips. So vision and hearing-related disabilities are the most common, and followed by physical disability. Comparing urban to rural, disability is higher in rural areas than in urban. So 1.2% versus 2.1%. By the way, some of the studies that I mentioned here, Ruxi has the slides, so if you'd like a copy, please ask him, and it's fine. Also, I forgot to mention that if you have any clarifying questions as we go, just feel free to stop. International forums, Nepal is sort of praised as a good student, like an A+ student when it comes to disability policies, because at least on paper we've got some really good things happening. I'll talk about some of those, but it is quite. I mean, the disability numbers remain high. In terms of the policy effort, the I guess one of the most extensive review that I've found is by Brigitte and his colleagues. This would be 2020, by the way, not 2000. And Bodel and other and colleagues from a report in 2018. Basically, to look at how the different policies have evolved on disability. I'll just provide a very brief overview here. Looks like the earliest effort on protecting the rights of disabled individuals with disabilities started around 1982 with this Disabled Protection and Welfare Act. But then there was this pause of almost 8 years, and the corresponding regulation was formulated in 1994. There were other policies in between, the Education Act of 92, Child Rights Act of 1992, Local Self-Governance Act of 1999. All of these sort of focus on education for children and how do we ensure rights of children with disability, right? Not the general population. The National Policy and Plan of Action of Disability 2007, it outlines 17 priorities to empower individuals with disability. Again, these are really general. If you look at what the priorities were, it's like collecting better data and ensuring these rights. It is really, there aren't really specific milestones listed there. But the real change seems to have come around 2017 with this Rights of Persons with Disabilities Act, 2017. That's the one that basically led to the categorization of disability in 4 colors. And you may have heard of this. There are 4 colors now, and based on which color disability you have, you get different support systems, right? So, anyway, other acts after that, including this Safe Motherhood and Reproductive Health Rights Act, also specify that the programs that we provide, the government services, need to be disability inclusive. The takeaway here, there's a lot here, is basically there are policies in place to protect the rights of individuals with disabilities. Now, the extent to which those are sufficient, that's a debate that needs to be verified. Despite these policies, again, at least on paper, as is well known, there are substantial barriers that individuals with disability face to live up to their full potential. In education, lack of resources for inclusive teaching, it's very common. Bullying from peers, largely due to stigma attached to disability is common, and all of these affect enrollment, attendance, and attainment. As several of you are education experts, I don't think I need to belabor this point. In terms of physical barriers in seeking services, again, statistics are very difficult to come by, but I found this report where the National Federation of the Disabled, they did a survey of 150 public infrastructure in Kathmandu and found that 132 were inaccessible, 18 were partially accessible, and none was fully accessible to people with disabilities. So again, accessibility is a big problem. Stigma is common, affecting well-being in areas beyond health and education. We'll look at effects on marital prospects, and we'll see that the effects are quite large. And discrimination against individuals with disability, it's sort of embedded in every everyday culture. And as a little exercise, I asked my my nephew and niece to list a few Ukantuka that have derogatory terms referring to individuals with disabilities, and they came up with like 15 within a time of like half an hour, right? Things like no ni mama onda kana mama nico, and so on and so forth, right? These are really terms that people use in everyday conversations, not realizing that these are actually quite offensive. Now, to investigate, recall that again, the goal here in this study is to look at the effect of disability on several of these outcomes. So I'm going to talk about the data now. So we used the 15% sample of the 2011 census. This is publicly available with request from the Central Bureau of Statistics. So we had data on roughly 4 million Nepali citizens. The analysis is limited to Nepali citizens. And depending on the outcome, we have data on, we have a sample size of ranging from 529,000 to 1.2 million. Again, I'll talk about the outcomes in a minute. That's for the first paper. For the second paper, where we look at the effect of parental disability on children's outcomes, we have information on 1.8 million individuals, million child-parent diets. The key independent variable is disability status. In the survey, they asked this question: what is the physical and mental disability of so-and-so? And they provide 9 options. The options are physical disability, blindness. If an individual was reported to have any of these disabilities, that counts as 1, 0 otherwise. So basically, we look at the effect of going from no disability to any form of disability. I want to note here that this definition has changed in international surveys, including in the Nepal census. So when the 2021 census comes out, we'll be able to look at, we could do a similar analysis, but looking at a better classification that's now more widely acceptable. There was a Washington group on disability statistics formed a few years ago that came up with these broadly more appropriate categorization of disability that the Nepal census has now followed in the 2021 census. But for now, we'll use the one that's available in the 2011 census. And part of the reason why in this analysis we then look at effects, what the Census Bureau does if you request a census data is they give you a 15% random sample. It's supposed to be representative.
And the second study data, which you mentioned, like parent-child diet. So, is it the data present in
that you have to account for? But it's doable. And again, because this is a public good, I'm happy to share. If you end up doing research on this topic, I'm happy to share the 2 files and what have you.
Yeah.
I use data, so. Okay, so any other clarifying questions before I move on? So here are the outcomes that we look at. Some of the outcomes are very common across studies that use data from multiple countries, things like enrollment, whether somebody is currently in school, completed years of education, continuous, and please correct me if I'm saying this wrong, but attainment is one of the most commonly used education outcome. And even employment, it's widely used. Labor economics use that a lot to look at the outcomes associated with interventions. In this analysis, we decided to extend that a little bit beyond what people have looked at in other contexts, mostly to capture Nepali-specific nuances that these broad indicators wouldn't capture. So, for example, it's possible that you're enrolled and eventually you complete some level of education, but you may not graduate on time, right? So we look at this grade for A's as an outcome. So this is whether you are in, for example, at the right grade level for your A's. Were you in grade 1 by A6, in grade 2 by A7, so on and so forth. Likewise, even if you are employed, you might be employed in a job that doesn't pay well. You might be employed in a job that's very difficult. And so we look at employment in full-time salaried job as an additional outcome. So for marriage outcomes, we look at early marriage because unfortunately early marriage is still a problem here. And so we look at whether somebody gets married before the age of 15 as an outcome. Whether you're currently married, roughly, even in the 2021 census, at least based on the data that I've seen so far, roughly 97% of men and nearly 99% of women get married by age 30 in 2021. I don't want to make a judgment as to whether getting married is the preferred dominant outcome for well-being, but in a context where nearly everybody gets married by age 30, looking at marital outcomes is an important outcome just to capture some setting-specific stigma that may be associated with having individuals with disability getting married. And then we look at age at first marriage. Now, in terms of if you look at the paper, I actually walk through all of these outcomes and explain which way the direction of causality might go, the effect might go. So for early marriage, it could really go either way, right? If you have disability, parents might be encouraged to get you married early on, thinking that if you stay longer, you might have more difficulty getting married. On the other hand, marital prospects fall substantially with disability, and so you may not be able to get married. So empirically, it could go either way. For some of these, it's quite clear, right? For enrollment, it's quite clear. For some of these other outcomes, it's not clear. It's an empirical question. This is the derivation of the analytical sample. Again, the country's population at the time was 26.4 million. Got the 15% sample, and then we take out. This is for the first paper. We take out non-Nepali citizens, and because disability is the key variable, anybody for whom we don't have disability information, we have to remove them. And based on the inclusion criteria, so for education, we look at individuals 5 to 18 years. For employment, we look at people who are less than 60 years, not currently in school. And again, for marital outcomes, we look at people who are of different ages. So based on these inclusion criteria, the number of individuals that we have for each outcome is slightly different. That's no need to worry. If in the table you see this sample size changing from one specific to the other. It's just the nature of the analysis. For the second analysis, which the second paper that you were asking about, so in the census there is information on relationship between household members, and we use that information to create parent-child diets. Right? Now this analysis comes with a number of, I guess, more stringent limitations, which I will talk about, including the fact that this captures people who are still living with parents or reported to be living with parents. So, Basai Sarai Goreko, those people are not captured in this one. So, to the extent that those things matter for outcomes, the estimates would be biased.
What's the rationale for that?
Because in the census, in the household listing, if you have somebody who's said, Basai Sarai Goreko, then you wouldn't be captured under that household.
Okay, yeah.
Sorry, what are you saying? Oh no, the clarifying questions are fine. It's, if that's okay. All right. The other thing is, we've also limited the secondary analysis to people for whom we have information on the district of residence. That's because we compare people within the same district. Given that opportunities for education and employment have you changed drastically from one district to the other. So you can't compare somebody in Kathmandu to somebody in, say, Basuda. So it's within district comparison, which is why we limit it, again, take out anybody for whom we don't have information on district residence. I have until 45, right? Yeah. So the empirical approach is pretty straightforward. So for the first paper, again looking at the effect of your disability on your own outcome, we estimate the linear regression of the following form. Basically, the idea is to look at the effect of disability on the outcome for child I in sibling pair J, accounting for a set of confounders. And we include, so theta there is the sibling pair fixed effect, and neta is the birth year fixed effect. Now let me try to explain this in a little bit, I guess, more intuitive English. In a topic like this, obviously you can't randomly assign people to disability group and non-disability group, right? What we can do though is Now, if you were to compare just people who have disability and people who don't, they could differ in several other things. So it is possible that people who have disability are disproportionately from poorer households. So if you were to run a simple regression, a cross-sectional regression of the outcome on disability, estimates would be biased, and due to the fact that those people are inherently very different. The issue that we economists refer to as selection, right? What this method does here is to take two children within the same household and compares their outcomes, right? One with disability, one without disability. Right? Now, when you do that, right, any differences in your disability status or outcome that's because of poverty or what have you, that's parsed out because children within the same household face the same external circumstances, including poverty. That's the idea, right? Now, this comes with some caveats too. So it's not fully causal, which is why throughout the paper we refer to this as plausibly causal. Again, just trying to move beyond standard heavily biased regression results to something more, something that we hope would be more useful for policy. And I will share those limitations in the next slide. But the second paper, because there's no variation, it's a simple, outcome is your outcome, and X is the disability status of your parent, whether it's your mother's disability or your father's disability, and the controlling for a range of covariates on which we have information, things like does the household have access to health facilities, how far they live from, to water and sanitation, how far they live from the nearest road, whatever we have in the census, we control for that. Because we look at several outcomes, we do what's called a Bonferroni corrected p-values. Right? This is accounting for the fact that when you look at so many outcomes, statistically you're likely to find some effects significant by chance, and we want to remove those possibilities. And again, some of you who do this empirical work might be wondering, some of your outcomes are binary. Why use linear? Why not use binary? Now, in this case, it doesn't really matter because most of the prevalence rates are near the, they were nowhere close to 0 or 1, where using binary versus linear would make a difference. But to reassure you, the findings are robust to using other forms, including logistic regressions that some epidemiologists like to use. Okay, so here are the descriptive comparisons. This is outcomes by disability status. Again, remember that this is comparing somebody with disability to somebody without disability. So these are heavily, these estimates are biased, right? We haven't controlled for anything. I just want to walk through just a couple of numbers here. If you look at, so for enrollment, for example, among 5 to 18-year-olds, individuals who have disability, the enrollment rate is around 67%.
Is there a way to make the slide a little bit bigger, or you're like your eye test is working over? Simply check it.
I was worried. Please hold on a minute. यस्तो गर्नु स्लाइड अनि त्यहाँ लगाएर
जुम गर्ने मिल्छ
प्रोजेक्टर बुढो चाहिँ भयो
डिसेबिलिटी लाई प्रोजेक्टर
Any better?
Yeah,
I'll read out some of the numbers.
it's better now. Thank you, Ruchi.
So for enrollment, it's 67% versus 85% for those who don't have disability. For something like whether you're at the appropriate grade for A's, the differences are huge even without controlling for anything. So 31% of children 5 to 18 who have disability, they are at the right grade level for their A's, compared to 49% for children without disability. Same thing with other things like whether you're employed, strikingly, people with a disability are more likely to be employed, as expected. They are more likely to be married by age 30. Anyway, these are descriptive, so I'll not. That's the right answer. Great. Thank you. So this is for the comparison based on parents' disability. So my parents' disability, my outcomes. Some of the findings are a little strange, and I'll point those out when we look at the regression results. But what we see here, again, is that if your parents have disability, you fare worse in almost all of the outcomes. Right? Now, in terms of employment, we actually find later in the regression, you will see that if your parents have disability, you are more likely to be employed. Right? And this is due to the fact that if your parents have disability, you are more likely to take up employment early on than otherwise to bring, I guess, income to the household. Also, you're more likely to get married earlier if your parents have disability. And that's also consistent with what we hypothesized in the paper, which is that particularly if the mother has a disability, the son is more likely to get married earlier to bring in extra labor to the household. So those are the descriptives, but the fun stuff is coming. Now, before I get to the actual main findings and then the takeaway messages, I want to be very clear on the caveats here. Usually the caveat section goes to the end of the paper, but I just want to put it up front. One is that the data are from 2011, so a lot has changed since 2011. So take it with a grain of salt, right? I really wanted to update these numbers, and actually when Ruxi and I talked about the possible date for the presentation, I purposefully picked something in July, so there'll be some time to do analysis with the 2021 census. But it turns out that the 2021 census data will not be available for another 6 to 8 months. As I found out yesterday. So anyway, so yeah, these are old data. The other thing is to keep in mind is that the categorization that's used here to capture disability, it doesn't follow the international classification system that's now widely used. That limits comparability. But also, if you look at the question, it's meant to capture extreme forms of disability. So this is really sort of the estimates are probably upward biased. The paper on the first paper looking at the effect of disability on your own outcomes, it doesn't account for the fact that parents might reallocate resources within the same household because we compare siblings in the same household. But if my brother had a disability, then it is possible that the resources that are available to me would fall, right? Or it's possible that if parents are really bad, they might actually put in more resources towards the child who doesn't have disability to get the maximum return on whatever, right? So it could go either way, but that is a limitation of this study. The second paper, again, the parental disability and child outcomes one, these are not causal. I will use the word effect every now and then for brevity, but these are all associations and they should be taken as such. Now let me go through the key findings of these papers. Now, individuals with disabilities are at severe disadvantage in virtually all outcomes that we look at. Just to provide some numbers, and when we're looking at this box here, these are coefficients from that regression that I showed before. The way to read these numbers is that a child who has a disability is 16.5 percentage points less likely to be enrolled, accounting, than a sibling who does not have disability. Now again, these are within the same household, right? A child who has a disability is 6.9 percentage points less likely to be at the correct grade level compared to a child who does not have disability. Right? On average, a child with a disability has about half a year less attainment compared to somebody without a disability. And in terms of employment, the difference is about 21.4 percentage points. So it's like saying if 60% of people who don't have disability are employed, the number for individuals who have disability would be 60 minus 21.4. It's a big effect. We don't see any effect in terms of the type of jobs that they end up taking, conditional on being employed. Again, this is conditional on being employed. Strikingly, if you have disability, you're less likely to be married before the age of 15. This might have to do with the stigma, but it does appear that disability, having a disability, has some protective effect against child marriage, early marriage. Okay. However, like I said, roughly 97% of people, women, men, and 99% of women get married before the age of 30. If you look at the marital status of everybody who's above the age of 30, people who have disability are 30 percentage points less likely to get married, to be married. Right? So essentially, it's the protective effect that we see in early marriage and not being married even after 30 is those two numbers are consistent. As an aside, now this paper was not meant to compare outcomes for boys and girls straight, right? It was meant to compare the differential effect of disability on boys and girls. However, the analysis, the setup allows us to look at, just compare outcomes for boys versus girls that other studies have documented. I'm guessing Pramadai and others have documented this, looking at gender differences in education and other outcomes. You do see that that consistent with what we see in other studies, girls are, the study does confirm that girls are at a much huge disadvantage when it comes to educational and employment and marital outcomes. Right? The only exception, and this is an area for further research, is that girls are more likely to be at the appropriate grade level than boys for some reason. I don't know why, but it's something that I hope to explore. Now the first finding was the severe effects. The second key message that I want to share is that girls with disabilities are at a much bigger disadvantage than boys with disabilities. I have some numbers highlighted here. This is true particularly for educational attainment and marital status, being able to get married. So comparing just gender disadvantage and disability disadvantage. So being a girl and not having disability versus just having disability, right? So if you compare those, without disability, boys have about 0.46 years of higher attainment. With disability, that increases by nearly 2.5 times. Right? So that gap widens to 1.24 years of attainment. Again, the message here is that if girls have disability, it becomes a much bigger problem for them than boys. Getting to the second paper, now the red box up here is for the effect of father's disability on the son. Right? You don't see much, except one kind of strange finding, which is that boys are more likely to be enrolled in school if their father has a disability. I don't have an explanation for that. However, for girls, it's the red, because the regression result doesn't give you those numbers straight away up. Generated some numbers down here for the effect of father's disability in girls. And it turns out if the father has disability, even though it doesn't have much effect on boys, girls are less likely to be enrolled, they're less likely to meet the grade for age, and they are much more likely to take up employment early on. That's for fathers. Now when the mother has disability, again the blue line up there, that's for boys. So boys do suffer in terms of not meeting the grade for age requirement, having lower attainment, and taking up jobs early on, right? However, for girls, the effects are actually for girls the effects are similar. So both boys and girls suffer if the mother has disability. So overall, it appears that if the mother has disability, the effects are more pronounced than when the father has disability. And you can actually see that in terms of mother's disability, the thing that I mentioned, the 0.19 there, that is saying that if the mother has disability, boys are 90.6 percentage points. So this is roughly 0.2 years. They get married 0.2 years earlier than when mother does not have disability. So I know I've shared a lot of numbers. Now, just want to give the takeaway messages that you can remember as you leave the door. One, lack of disability inclusive policies leads to severe disadvantage in almost all of the outcomes that we've looked at here. Ranging from education to employment to subsequently getting married. These adverse effects percolate across generations, particularly when the mother has the disability, and these effects are more pronounced for girls overall. Now, some of these things we already knew, right, based on the context and so on and so forth. But the goal here is to put a number to these, so that when the government actually thinks about, what type of support system needs to be there, what is the amount of money allowance that needs to be given to the individuals. It can be based on like the magnitude of the disadvantage that's there precisely because of disability. I want to conclude with one last slide. So in terms of what we're planning to do, and I have 2 minutes. One is, the natural next step here is to replicate the analysis with the 2021 census data, and also compare 2011 findings to 2021 findings, so we can see if some of the policies that have happened in between these years have improved the situation of individuals with disabilities compared to individuals who don't have disability. We didn't look at in these two papers. We haven't looked at differences in effect across other dimensions of disadvantage like caste and ethnicity and poverty. That is a natural next step. And then looking at effects by disability type, like I mentioned before, we didn't do that because of the classification used. We hope to explore some of the unusual findings, like why is it that when the father has disability, boys are more likely to be enrolled? Why is it that the girls are more likely to generally meet the grade for age requirement than boys? That sort of thing. Slightly, I guess, once that's done, the medium-term goal is to look at the sufficiency of the existing social protection programs on disability and see if, based on these widespread effects, disadvantages, if those protection programs are sufficient. Right? So that's the next step. And I guess further down, then we'd have to think about looking at interventions to reduce stigma associated with disability, and maybe this is even further down, like how do you encourage people to make investments in disability inclusive infrastructure, so that individuals with disability can have the same well-being as those who don't. Any other suggestions? I'm open to hearing those. At the end of the slides, I have references to all the papers that I mentioned. I've got my email address there, and I also have linked to the 2 papers. So I look forward to having more continued engagement. But for now, I'll stop here and leave these slides so we can have a discussion.
Yubrajjiलाई धन्यवाद. So it's our turn to ask clarification seeking questions or comments or whatever else. So
thank you for a wonderful presentation. I mean, as you said, that arguments are pretty clear, but putting the numbers is more important because the numbers that we now know. So I have just a quick clarification because I've seen the census data for 2021 and disability data is already out. It's been over a month. So at least the basic number of the 9 categories data that they have is already out. So I think that they should be having the detailed data also. I don't know how they said that 8-9 months. I think, but I can send you that Excel sheet that the CBS has on the disability data. So you may check if that is already out, but the detailed data is they can provide you now. And the second the argument is this. I mean because also there is the problem of reliability with the census data that many people are calling about. So perhaps, and also the national sample survey data comparison with that how reliable that sample survey data is. But but there is a one interesting database that actually is not worked in Nepal, and perhaps I mean because you are doing a data work wonderful, so maybe to check into that. For example, you have a social security program, and every disability people get some incentives from the local government, and that is very well computerized databases in Nepal, and that is very well documented, and all that money goes via account and all the categories of the disability. So that is the pretty much reliable and robust database. If you can get that database and then to check if the CBS data is reliable or not. So perhaps that database, I don't know if they put out that number in the same category of the CBS database, but the people are getting the incentives in a different form of disability, and from a municipality they are getting rural municipality they are getting some incentives of the government social security program. So that database would be the actual database where the peoples are active, and all the details, historical details of is possible from there. So perhaps compare the CBS database with those kinds of the database may sound more logical, because CBS database many will question that it's not that reliable in terms of numbers.
Sure, thank you. So the census data, for this analysis, we actually need the raw data, which they don't have yet. And you know, I spoke to somebody on the phone yesterday, and they said another 6 to 8 months. And the overall numbers are there, but for this analysis, we need beyond that, numbers beyond that. The second comment about social security database, that's an interesting one. Again, the problem is when you want to compare individuals with disability with those without, right? You also need information on individuals who don't have disability for the outcomes. So again, it's based on the research question. This is the best we have, right? I mean, it's got its limitations. For the first analysis, to the extent that disability, the measurement error within the household is the same, in the same direction, I think we're fine, because we're comparing children within the same household, right? Methodologically, but I understand that you know, these numbers can be problematic depending on how the census collects. But I do want to sort of give some benefit of doubt to the data collectors and say that, you know, these are the best data we have, right? And we have to sort of go with those.
Yeah, go ahead.
Thank you. I have a couple of questions.
Louder, please.
So, do you then exclude single child households in this analysis and plan to include that in your later studies? Also, could you go back to the effect of mother's disability on boys and girls and like sort of talk about some of the differences in numbers there? Because you did say there were similar results, but if there were some differences in numbers there. And this is more like maybe a qualitative sort of question. When you said when a mother has disability, it sort of the effects percolates over generations. Could you expand a little bit on that? And also, like, why do you think particularly when the mother has a disability, the outcomes are so significant? And do you plan to expand the definition of disability in your later studies? Because you did say you were only looking at extreme forms of disability.
So I'll start with the last one. Yes, definitely. I mean, the definition, you know, it's already in the plans, and I think I can reveal this here. But I'm working with Dr. Kamal Lamisane, who's done a lot of research in this area, and I hope it's okay to reveal that this is the only visually impaired individual in the country who has a PhD in this topic. So we're actually working on this topic. And I want to make sure that, you know, whatever we do is sort of reflective of the lived experience as well as the ground realities. Now, when the first comment on whether we want to include individuals who are the only child in the household, when you compare siblings within the same household, the setup is such that you need to have one child with disability and one without. Right? So that's the variation that we're utilizing to get the causal effects. You could do an analysis using everybody else, right? But then it won't be as causal as we want it to be, because individuals who are disabled and who are not disabled, they might come from very different backgrounds and households. What we do have done in this analysis, it's in the supplementary analysis, is compare households who have at least one child who has a disability and one child who does not have a disability. So the sample from which the variation is utilized to get the causal estimate to the entire national samples to see, sort of comment on the external validity of our findings. We've done that. But just to utilizing just the single child data would not be possible given the empirical approach. In terms of the your the third question was about why we think mother's disability has more profound effects on children than that of fathers. I have a theory, but I don't have a clear answer. If we look at there's some work in economics where people have given cash transfers to mothers versus fathers, right? And they found that mothers tend to bring investments that are more beneficial to the child than fathers, right? Sort of a parallel thing seems to be happening here. If the mother has disability, the damage to the household in terms of what they can accomplish is likely more, because mothers tend to do more of the household work and what have you. And as a result, if you're a child, you might end up getting married earlier, either to bring in extra labor to the household or to reduce strain on your resources when mother has disability. When father has disability and the mother does not, then you have mother to take care of the father. Now, unfortunately, when the mother has disability, the chances of the father taking care of the mother are likely lower than when the father has a disability and the mother takes care of it. Just the nature of the gender thing. That's my hypothesis, but that's to be. I guess that's something we could want to evaluate further. Now, you wanted to go through this table a little bit more. Now, the way to read these numbers, for those of you who are empirically inclined, is this shows the effect of father's disability on boys. If you want to get the effect of father's disability on girls, then you'd have to combine this coefficient with that, right? Which is why further down I put just the p-values from those combined estimates, so you can see what the effects are, right? So for boys, it's easier if you just look at it. Look at this box, right? And that box, as far as mother's disability is concerned. And for girls, you would have to add those with the interaction terms to get some estimates and check their sort of p-values, if you will, right? And these are the significant, anything on bold here is something that has a low p-value, meaning these effects are unlikely to happen by chance. And so as you can see here for girls, you see effects on currently in school, appropriate grade for A's, and currently employed. This is for fathers, disability for girls. And for mothers, you see the same thing, except in the case of currently in school. So there are some, overall, I mean, if you were to ask me to summarize this in one sentence, I would say that with mother's disability, the effects are, for boys, right? Mother's disability has a bigger effect, as you can see here, right? Comparing that to that, right? With father's disability, for girls, also similar, right? However, if you were to look at some of these outcomes that you see here, right? This thing here, right? It's very clear that that when it comes to getting married early, mother's disability has a negative effect than boys.
अघि तपाईँले male versus female comparison गर्नुभयो disability and then we look at gender differences outcomes across different genders and especially females now outcomes were worse among disabled children. But मैले मिस गरेँ जस्तो लाग्छ एभरेज पपुलेसनमा जुन डिफरेन्स छ मेल versus female त्यो डिसेबल भएको कारणले worse भएको कि or is it how is it like general difference भन्दा फरक के यो अलिकति clarification.
Sure. This is the first paper where we look at the effect of your disability on your outcomes, right? यसमा यो फर्स्टमा चाहिँ यो डिसेबिलिटीको कारणले बोइजहरुमा हुने इफेक्ट हो. यो एड गरे भने चाहिँ we get the effect of disability on girls. This one, the one that's on red, is the effect of just being a girl. It's got nothing to do with disability, right? So this is the disadvantage that you have simply for being a girl in this country. This one, right? So I agree. There are two things. One is just the effect of being a girl, and this wasn't the main focus of this study. We were interested in looking at the differential effect of disability in boys versus girls, as opposed to just the gender gap. Right? Gender gap has been widely documented. I don't know, Dr. Onda and Dr. Walt, but I don't know how close these numbers are to what you have documented when it comes to looking at gender differences in attainment and enrollment. But this one is basically saying that in attainment, it's about 0.6 years of difference. And in enrollment, it's 1.7 percentage points. The baseline numbers are pretty high right now, right? It's about, I think it's more than 85%, even in the 2011 census. These numbers are probably much higher now. But even, it's about 2% difference in enrollment.
Disability accentuates that.
Yes, disability accentuates that because for girls, you have to add this and that. Right? So it's, with disability, girls have about 0.17 percentage, sorry, so 0.17, so 17 percentage points versus 1.7 for just being a girl. In other words, disability has a much bigger effect on outcomes than simply being a girl.
एउटा उदाहरणमा हामी जिज्ञासा खोज्ने प्रयत्न गर्नुभयो किसान परिवार जहाँ एउटा बच्चा हुन्छ 3 वर्षको है बालवानमा परम्परागत खेतीबाट माथि उठेर तरकारी खेती थाल्नु है बच्चा 3 वर्षको छ अब तरकारी खेती गर्दै जान्छ अब अर्को 6 वर्षमा एउटा बच्चा जन्मन्छ तर दुवै बच्चा डिसेबल भइसकेको हुन्छ दुवै बच्चा अब हेर्नुहोस् है दर्दनाक स्थिति त्यो 3 वर्षको बच्चा 6 वर्षमा पुग्दाखेरि मोबाइल खेल्दा अटिजममा आएर डिसेबल भइसक्छ खेती गर्ने प्रक्रिया अन्तर्गत त्यो विष प्रयोग गर्दा अर्को बच्चा जन्मँदाखेरि डिसेबल त्यसो भयो यो त आउटकम रहेछ डिसेबलिटी डिसेबल चाहिँ को छ हाम्रो राज्य हामीले अभ्यास गर्ने नीति व्यवहारको डिसेबल त्यसो भए हुनाले यो परिणाम पनि प्राकृतिक होइन रहेछ यो नेचुरल होइन रहेछ यो त कृत्रिम रहेछ अब समाधान के त गम्भीर परिस्थिति सृजना यस्तो श्रृङ्खला त दोहोरिरहेछ त्यसो भए अब हाम्रो रिसर्चहरू कहाँ तपाईँको केन्द्रित यतातर्फ पनि ध्यान जानुपर्ला मैले होइन सन्दर्भ उठाउनु पर्ने हो धन्यवाद
यो एउटा चाहिँ मैले अहिले सुरुमै मैले क्लियरिफाई गर्नु पर्थ्यो यो हेरेको चाहिँ इफेक्ट अफ डिसेबिलिटी भन्दा पनि इफेक्ट अफ ल्याक अफ डिसेबिलिटी इन्क्लुसिभ पोलिसिज हो डिसेबिलिटी बाइ इटसेल्फ इज नट अ प्रब्लम त्यो मिसकन्सेप्सन आउँछ यो चाहिँ हाम्रोमा ल्याक अफ पोलिसिजको इफेक्ट हो सबै हेरेको यदि सबै स्कुलहरू डिसेबिलिटी इन्क्लुसिभ हुन्थ्यो भने यो ग्याप सुड नट बी देयर सो दिस इज मोर अफ द इफेक्ट अफ ल्याक अफ पोलिसिज तर यहाँले भन्नुभएको आई टेक द्याट टु हार्ट कि यसको सोल्युसन के भनेर हामीले सोच्नुपर्ने हुन्छ र इट लुक्स लाइक हजुरले भने जस्तै यो साइकलमा पर्पेचुएट भइराख्ने प्रब्लम भएको हुनाले त त्यसको एक्ज्याक्टली के समाधान भन्ने चाहिँ मसँग छैन
So you mentioned about district-wise models, and so you meant like you ran district-wise regression. To first question. Second thing, sibling pair fixed effect भन्नुभयो. Is it similar to like household fixed effect? So
household fixed effect sorry.
अनि जुन हजुरले पछि चाहिँ यो इथनिसिटी र कास्ट वाइज पनि हेर्नु छ भन्नुभयो नि त सो हजुरले यसमा चाहिँ कन्ट्रोल राख्नु भएको छैन इथनिसिटी र कास्ट भन्ने चाहिँ त्यो भयो अर्को चाहिँ जुन सेकेन्ड पेपर छ नि यो पेरेन्ट्स विथ डिजेबिलिटी सो हाम्रो चिल्ड्रेनमा पनि डिजेबिलिटी छ कि छैन भन्ने त्यो डिस्टिङसन गरिएको छ कि छैन लाइक पेरेन्ट्समा त डिजेबिलिटी होला बट त्यो चिल्ड्रेन डिजेबल छ कि छैन भन्ने अनि अर्को चाहिँ
यसो गर्नु पर्यो Can I ask him to respond to your questions? It's a wrong list of questions, right? So confused हुनुहुन्छ होला अहिलेसम्म सोधेको जवाफ दिनु पर्यो
I'm confused about it. So the way these fixed effects work, right? The district fixed effect you're comparing individuals within the same household, same district.
yeah.
You do the household fixed effects, you're comparing children within the same household. Right? We call this, instead of calling it household fixed effect, we call this sibling pair fixed effect because we want to compare one child to the another child. We don't want to compare people within the same household because you don't want to compare son to the father or son to the mother and so on and so forth, which is why it's not a household fixed effect, but it's the same idea. Right?
So
you could have household fixed effects, you could have sibling pair fixed effects depending on your outcome, right? Depending on what you are trying to get at. As much as sibling pair fixed effect is probably better.
Do you mean like in a same household there are multiple parent sibling dyads and to like capture that you're using that?
In the first analysis, we're not looking at dyads.
Yeah,
we're looking at just multiple children in the same household. Right? So these are multiple children basically born to the same parents. So it's like comparing die versus I.
Yeah.
Right? District fixed effects map. So there are multiple ways to do these fixed effects, right? In these statistical softwares now, basically you include a dummy for each district in the analysis, and what you get is an estimate of the effect based on within district comparison. So you're not comparing a child with a disability in Kathmandu to a child without disability in Basra, like I said. So it's district analysis. In the parent-child analysis, the second one, we do control for ethnicity and caste and the disability status of the child. It's just that that's not the focus, right? But we do control for a range of factors, including that. Now, in that analysis, you cannot control for caste because within a household, caste does not change.
Yeah.
So with fixed effects, you're only looking at things that change between the siblings within the household. So that would drop out.
Yeah.
That is a good
No,
question.
my turn. यो तपाईँले भर्खर कमेन्ट गर्ने बेला पनि इफ युआर इम्पेरिकली इन्क्लाइन भनेर यसो भन्नुभयो मैले जर्नलिस्टतिर यसो हेरेँ कि मलाई यो नम्बरहरू के पनि डर लाग्दैन आई हेड डन मोर म्याथ देन मोस्ट ग्रेजुएट स्टुडेन्ट्स इन इकोनोमिक्स बिफोर आई अराइभ एट युनिभर्सिटी अफ पेन्सिल्भेनिया होइन म्याथ वाज माई माइनर बट एज वी अल नो there's a certain number imagination fixation. अब तपाईँ you trained as a economist. तर अहिले नेपालमा चाहिँ पोलिसी इन्टरभेन्सन्सहरू नम्बरको बेसिसमा भएको जस्तो भन्न त भनिन्छ तर एक्चुअली पोलिसी इन्टरभेन्सन्सहरू नम्बरको बेसिसमा भइरहेको जस्तो मलाई चाहिँ लाग्दैन होइन सो द्याट्स लाइक हाम्रो वर्किङ रियालिटी इन द कन्ट्री भयो होइन इन्टेलेक्चुअली सोचौँ न I assume that you are now housed in a department which is multidisciplinary. So you probably have colleagues who are not economists. Right? Can you imagine putting together a volume that talks about disability in Nepal that is multidisciplinary in that way? Which, because you already have tenure, you could afford to do that now. Right? No, why am I asking this question? Right? If you want to actually highlight your own research focus and invite a new generation of Nepalis, to actually join this research enterprise, you're going to need that kind of volume. We've tried to do that from here in many different subjects over the years. But I don't see a volume on disability produced by anybody. There was one journal on disability that came out exactly one issue, okay? One issue, and I don't think the people who were behind that journal actually had an intellectual academic agenda. They were interested in kind of real doing stuff. So is this in your plan of action in the next few years? To put together such a volume. Increasingly, I feel like पहिला त यस्तो भनौँ नेपालबाट निस्कनु पर्छ जस्तो लागेको थियो मलाई तर द प्र्याक्टिकल डिफिकल्टिज अफ पुटिङ टुगेदर सच अ भोल्युम इज इनर्मस लेट्स से इफ यु हेभ articles, 3 articles that are proposed for the volume that were originally published by Taylor and Francis. To get permission to reprint them is either enormously difficult or enormously expensive. One recent attempt on our part here on another subject, Taylor and Francis, जस्तै publisher they wanted $780 for one article to reprint. So possibly putting together such volume through Routledge, and then making a deal based with a publisher based in Delhi, will put out a special Nepal edition. भर्खरै Routledge-को 10-15 वटा किताब चाहिँ स्पेशल नेपाल एडिसन भनेर छापिएको छ, बजारको सबै पसलमा छापछापी पाइन्छ हैन। यो मैले किन भनेको भन्दाखेरि चाहिँ I think there's now enough people like you who are based in North America, Europe, Japan, Australia who can do this perhaps in an easier way than those of us based in Nepal. यो हो कि हैन तपाईको के विचारहरु छन् त्यसमा?
First of all, मैले सोचेकै थिएन भोल्युमको बारेमा, to be honest. Partly because of the way that incentives work in US academia, right? It's papers more than books that count. But I think like you said, now that I have 10 years, something to think about. I mean, and it's true. I mean, it's the खालको analysis को लागि, I think it's not sufficient to put numbers like we've done here. And in fact, in both of these papers, we make an argument that to understand some of these mechanisms, we need more interdisciplinary research, more qualitative work, just so that just to corroborate some of those numbers and to understand the sort of the stories behind these numbers. But I think that's something that I'll have to think about a bit more, and I'll have to seek your guidance on. But definitely, I mean, in terms of whether how well this fits into this agenda, this is my third leg of the agenda, so it's pretty up there.
Anyway, मैले तपाईको त्यो अघि प्रेजेन्टेसनमा the marital outcome is one of the title of the presentation and the paper. So there was something interesting going on. I mean, if you compare the two papers, the marital outcome kind of differs in a way. The early parental died early, and सुरुकोमा चाहिँ तपाईको चाहिँ तपाईले के पनि भन्नु भने quote unquote child marriage पनि गर्दै रहेछ भनेको. And if you look at the people with the disability and their access to and their social demography of marriageability, and it seems that they have a quote unquote problems. So for example, for people who think that marriage is an operation, marriage is to be married is a problematic. There is school of thought that sees marriage as a form of exploitation. How would that person be, you're thinking that, the bian that's a kind of like, a more ontological thing that I was getting at. But if you just rethink that whole, you reposition with that kind of thing, perhaps people might argue in a different way. That's just fine.
I agree. But I'm not making any judgment as to whether getting married is the preferred right outcome. But I wasn't thinking of marriage as an institution that could potentially lead to exploitation. But that's a valid point. Again,
I mean, then it can also goes back to different empirical, ethnographic, let's say qualitative research that focuses on what happens when the spouse were fine, but then one of them got into accident or got disability, and then we have many stories unfolding, leading to divorce, leading to separations, and so it's a very, I think perhaps using one of the things about this kind of studies is that we take this only as a variable, and then we talk about the outcome, and I think again the numbers are semiotics.
Yeah.
And it has a lot of connotations. So sometimes this connotation should be, and can be politically, that's the policy.
Right.
And also like politically, interpreting it different. So that's also thinking. But I understand that this is not your part of your purpose. I absolutely understand that.
Yeah.
But I wanted to bring that for the table.
No, I agree. Thank you.
बेसिकली युवराजले भने जस्तै यो फाइन्डिङ्सहरू अब एक दुईवटा क्यारेक्टर लाइक दिज आर नट सरप्राइजिङ टु यु एज होइन त्यो किसिमले चाहिँ हामी क्रिटिसाइज गरिरहेको थियो त्यो नै लार्जली भयो एक्सेप्ट फर द केस अफ गर्ल्सहरू चाहिँ राइट एजमा एनरोल गर्ने रहेछ भन्ने एउटा कुरा देखियो यो इन्ट्रेस्टिङ छ कि बेसिकली यो शिक्षा मन्त्रालयकै तथ्याङ्क हेर्दाखेरि पनि यो गर्ल्स र बोइजहरूको बिचमा 10 कक्षासम्म खासै डिफ्रेन्सेसहरू देखिँदैन कि एनरोलमेन्टमा पनि देखिँदैन उनीहरूले एभरेज अटेन्डेन्समा पनि खासै फरक देखिँदैन मिनिस्ट्री अफ एजुकेसनको स्ट्याटिस्टिक्स हेर्दाखेरि अनि एससीईको रिजल्ट आउँदाखेरि चाहिँ ठ्याक्क डिफ्रेन्स देखिन्छ कि एससीईको रिजल्टमा चाहिँ गर्ल्सहरूको जुन जे ग्रेड ल्याउँछन् अथवा जे जिपिए ल्याउँछन् त्यो र बोइजहरूकोमा सब्सटेन्सियली फरक देखिन्छ होइन सो त्यहाँनिर के होला भन्ने खालको त्यो जहिले पनि हामीले इन्फर्मली छलफल गरिरहेको छौँ बट वी डोन्ट नो वाइ द्याट इज द केस तर यो केसमा योभन्दा पछाडिको स्लाइडमा गयो भने युवराजले होइन अझै योभन्दा पछाडिको अझै पछाडिको
प्यारेन्ट्सवाला कि आफ्नै
यो पछिको यो
यो पछिको छ नि।
यो छ नि होइन सो बेसिकली तिम्रो फर्स्ट पोइन्ट यो ल्याक अफ डिसेबिलिटी इन्क्लुसिभ पोलिसिज लिड टु सिभियर डिसएडभान्टेजेस इन सेभरल की स्पियर्स अफ लाइफ नि यो त बेसिकली तिमीले एनालाइज गरेर छ सो भने यो पर्टिकुलर प्रेजेन्टेसनमा हामीले हेर्दाखेरि ओके सो जुन ठाउँमा चाहिँ यस्तो डिसेबिलिटी इन्क्लुसिभ पोलिसिजहरू राम्ररी इम्प्लिमेन्ट भएको छ त्यहाँ चाहिँ यस्तो किसिमको डिफ्रेन्सेसहरू छैन है भन्ने त्यो त्यस्तो एभिडेन्स के छ ग्लोबली
ए ओके ओके आई सी यो चाहिँ पार्ट अफ द वर्डिङ हेज टु डु विथ यो चाहिँ अब कति इन्क्लुसिभ छ एउटा ठाउँको पोलिसी अर्को ठाउँको कति छ भनेर कम्पेयर गरेर निकालेको होइन यो चाहिँ बेसिकली ल्याक अफ डिसेबिलिटीको इफेक्ट भन्दा पनि अल आई वाज ट्राइङ टु से हियर इन्स्टेड अफ सेइङ इफेक्ट अफ डिसेबिलिटी बिकज डिसेबिलिटी इज नट अ प्रब्लम इट्स द फ्याक्ट द्याट we don't have sufficient protection measures in place because of which we see these adverse effects from the world. So it's not comparing to also saying getting back to your
यो त तिम्रो अहिलेको यो के अरे स्ट्याटिस्टिकल एनालिसिस गरेर आएको फाइन्डिङ त भएन नि होइन
किनभने if you replace basically disability right with this part with disability it's the same thing right? So if you replace this first phrase with disability, you would say disability leads to several disadvantages, right? But the disability le bhako bhanna bittike you're almost being an ableist, right? That's the problem. Okay? So any effects that we see here, it's not because people have disabilities. It's because we don't have enough measures in place to support people with disabilities, right?
Yeah, so I was just wondering, like how much comparison is there in the actual paper? So okay, where there are very good.
It goes in silence. I think I see what you're getting at. Basically, you're saying different degree of inclusiveness co-effects custom You're saying paper. You're right. But I do want to give you some statistics. Nepal like राम्रो मान्छन् international forum ma disability ko bhanera. Enrollment numbers and 16 percentage points that we found here. In Bangladesh, it's 48 percentage points difference between disabled and not. In India, it's 33 percentage points. In Albania, it's 62 percentage points. So no, Nepal. You look at the documents and disability. Nepal, it's sort of like the FCSB's maternal child reduction and disability. Okay, it's like up there in terms of how well we're doing on that. Obviously. Talking to individuals with disabilities is a different scenario.
I have a question. Yes, please.
Hello, thank you for sharing this. I'd like to ask if works such as yours is there a pipeline or mechanism by which it gets translated into the federal parliament system where people actually have access to this and they're talking about this work when they're making inclusive policies for people with disabilities in Nepal. And next, I'll just add one more, is whether we could do a secondary paper on your papers. I think you're also going to analyze 2021 census data, right? So a correlation or divergence between your findings and what should be, the policies in Nepal in future and the policy that is actually coming out of the parliamentary or federal system in Nepal? A divergence study.
Yeah. So I think the second one, your second question, I think you could do it. I think it's going to be more of a, not so much of a data exercise than it would be of, like talking to people and getting more information on the ground on what policy is coming out and how that relates to what you would propose from the findings, right? About the first one, of your research, the limitation of research is that you do present in seminars like this and hope that it gets to the policy arena. I do want to mention that both of these papers have been cited in a USAID document that came out recently, where they were basically highlighting some of the disadvantages that I found in this study. But I agree. I mean, I wish there was more we could do as researchers, but it's other than presenting as.
You have some remaining questions?
Yeah, I can ask in person.
Yes, please.
Thank you so much for the interesting presentation. I have two questions. The first one is similar to your question, but more of ontological, what do you mean by like outcomes? I just wonder, it'd be interesting to consider the interest of people with disabilities before we interpret what we mean by outcomes, what we mean by outcomes. Because, for example, when we talk about access to the labor market, higher access to labor market among people with disabilities doesn't necessarily mean positive outcomes. They have to work instead of having education in school because of the lack of parental financial status. And also the question is maybe not merely the access to labor market, but more about opportunities. Because when I'm conducting data collection with people with disabilities in Nepal right now, the people, especially women with disabilities, they tend to talk about the job, the respected job. That's their concern. So instead of just talking about access to any job, we want to consider what kind of variety of occupations people with disabilities actually have. Because depending on the types of disabilities, people tend to have very similar kind of job. For example, if people have visual impairment, they tend to work in educational institutions. So it would be interesting to consider. And also, when we talk about marriage as an outcome, as he said, getting married by the age of 30 may not be the best interest, especially among the educated people with disabilities. And when I talk with girls with disabilities around grade 10 and their parents, they ask about, are there any role models who are having master's degree or PhD having disabilities in the past? So that's the question for sometimes. So that would be interesting to consider what is important for people with disabilities when we consider the outcomes. And another question is what we are not looking at from the statistics here. For example, the types of disability is restricted by the categorization of census. And in 2011 census, for example, the categorization is very limited, right? And for example, the government used mental disability to include various kinds of disabilities such as autism, ADHD, learning disability. We never know what they mean by that. So I think that would be interesting because access to education can depend on the types of disabilities, especially in Nepal. The access to education is better for people with visual impairment compared to, for example, people with physical disabilities because of the history of special education in Nepal. So that is also what we need to consider. And also, there are children with disabilities without parental care in Nepal. And these usually can be the most marginalized situation because they often do not have access to education, and also they often become the victim of corporal punishment or the gender-based violence by teachers or other adults. So that was my thoughts.
Yeah, fair points. I think on the outcomes I agree, and in fact, when we were scheduling this talk, I was insisting, Roxy, if we can get people, from disability organizations and people who have, the most recent development in disability work is that nothing about us without us, right? So it's unfortunate that we don't have any representation. But I fully agree, and whether the outcome is a good one or a bad one, if we could have people's own voices, then that would be more useful. Unfortunately, for something like this, right? You need a large data set to look at effects empirically, and you can collect data easily, right? So I think qualitative research would be the way to go on something like this. And I agree with you and Dr. Rai that we need to look at these outcomes, especially when we make judgments about what's a good outcome versus what's a bad outcome. I agree about respected jobs, and part of the reason why instead of looking at just employment, we want to look at salaried job is to try to get closer to what's a respected job, right? As opposed to something totally different. Also, again, on the type of disability, again, the 2021 census, actually, they have, for mental disability, I think have intellectual development related disability and then autism, and also for vision and hearing related disabilities, they have different categories, including severe and more moderate. So we should be able to look at some of those outcomes and how they differ by disability type. Right? And in fact, I think that's going to be the straightforward analysis. It's more of the what's a good outcome versus not part that I'm worried about, that we would not be able to look at the census data, simply because census doesn't get any of that. But yeah, thank you.
So thank you.
Thank you. Thank you again
for giving us the reason to be here in the room today. And as I said in the beginning, on Sunday we have Bhana Joshi presenting work on residents' perspectives of their landscape aesthetics and their implications, case studies from Jamrud, Bandipur, and Saura. Please come if that interests you.
Thank you again. It's good.